So, as Angelika said, there is no translation for this, so for those of you who are not as fluent in English, do let me know if I'm speaking too quickly, or if you have questions, please feel free to stop me as I'm going. The notes that you may have downloaded are most of the slides, but after handing in the notes, I also made more slides and things, so they won't follow exactly. So I talked a little bit this morning about how I got here, and Angelika said a little bit as well. Basically, I started by studying Chinese language, and I lived in Taiwan and I lived in mainland China and did a lot of study there. I'm also a translator, so in addition to the Pocket Atlas, I've translated a text on diagnosis, a text on medicinals, Chinese herbal medicinals, and my husband and I are currently working on another book on classical acupuncture therapeutics. So I am a practitioner, I'm a teacher, I'm a translator. I try to do more things than I should. In the midst of all of that, I had my first child 10 years ago, and that's really when I recognized how incredible acupuncture is with labor and delivery. And at the time, in the States, nobody was doing this. Nobody. I mean, every now and then you could find someone who, you know, treated their wife and maybe they would do it. The one person in North America who was really doing this was a man named Jean Levesque. And Jean Levesque is in Montreal, and he's been doing this for 20 years. He studied in Paris because at the time there was no other place to study acupuncture for labor and delivery. And he came down. Well, before, when I had my first child, he hadn't taught in the States at all. He had students in Canada, but not down where we were. And my first child, we sort of said, okay, I guess that what we're supposed to do are all the contraindicated points. Right, so let's do all the points that we were taught we're not supposed to do. And then once you get into labor, it's like, no, these don't feel right. And what ended up happening was that we had one needle. And we put that needle into spleen 6 during contractions, and we took it out afterwards. Then we put it into spleen 6 during the contraction, and we took it out afterwards. And every time we put that needle in, I felt the chi shift. And I was like, this is amazing. You know, one needle on one leg. And that's all we did. My midwife was thrilled. She had thought labor was going to take 24 hours, and we were done in about 8 hours, and that was great. The second one, we chose a different point. We chose gallbladder 34 because Jean Levesque said that is the most important point to use in labor and delivery, gallbladder 34. And it was. It was amazing. And again, we did the same thing. We needled it during contractions and we took it out afterwards. And again, every time you put that needle in, you feel the chi sort of move. And you feel things moving. And at that point I said, okay, something's going on here, and I need to learn about this. So Jean came down to New York and taught a class, and that was my first class that I took. And then a colleague of mine, we were classmates together, and she taught at several of the schools that my husband ran at the time. And she and my husband set up a program at a community hospital in Brooklyn, New York. And this is a hospital where most of the patients who come in have no prenatal care. They come in and they just, okay, I'm here, let's have my baby now. Good 30 to 40% of them are Hispanic, so they don't speak English. And we're going in and saying, hey, you want some acupuncture while you do this? And learning as we go. And she and I worked, she's still working there. I've moved out of New York City, but as we went, we saw and we learned and we thought, there are really different kinds. We read, of course. There, you know, Deborah Betts's book was the first one that we all said, okay, what's in here? And, you know, everything that we could read, we read. But there isn't a lot out there on how to do this, because we're all experimenting with how to do this. And what we really came to was that there are, as I said, there are you can go with basic, okay, there's a vacuity pattern or there's a repletion pattern, an excess pattern or a deficiency pattern, but there's more than that. And the better you are at differentiating the different types of patterns that women present when they walk in, and you don't get to do an intake often when you're working in a hospital because you've never seen them before.